Why are AIDS-related deaths still happening today? AIDS-related deaths continue to occur today for several reasons, despite the progress made in treating HIV. Understanding these factors helps shed light on the ongoing challenges in managing this chronic condition. One major issue is incomplete access to antiretroviral therapy. While around 77% of people living with HIV receive treatment globally, millions still lack effective therapy. Barriers such as limited healthcare infrastructure, stigma, and socioeconomic challenges, especially in regions like sub-Saharan Africa, prevent many from accessing the care they need. Without treatment, HIV can progress to AIDS, leading to life-threatening infections. Another factor is late diagnosis and delayed treatment initiation. Many individuals are diagnosed only after they develop symptoms of AIDS. This late diagnosis can significantly reduce the effectiveness of treatment and increase the risk of death. Although improvements in HIV testing have been made, gaps still exist, particularly among marginalized groups who face stigma or legal barriers. Adherence to treatment is also crucial. Lifelong adherence to antiretroviral therapy is essential to suppress the virus and prevent disease progression. However, challenges such as side effects, drug shortages, or social factors can lead to poor adherence. This can result in viral rebound and an increased risk of AIDS-related illness. Additionally, drug resistance can develop, making treatment less effective. Co-infections and comorbidities add another layer of complexity. People with HIV are more vulnerable to other infections, such as tuberculosis, which remains a leading cause of death among those living with HIV. Managing these co-infections requires integrated healthcare services, which are not always available. As treatment improves and life expectancy increases, the population living with HIV is aging. Older individuals face higher risks of non-AIDS-related health issues, such as cardiovascular disease and cancers, which can complicate care and contribute to mortality. Social and structural factors also play a significant role. Stigma, discrimination, and the criminalization of key populations hinder access to prevention, testing, and treatment services. These barriers perpetuate new infections and deaths. Despite these challenges, AIDS-related deaths have declined dramatically, by about 70% since the peak in 2004. However, in 2024, an estimated 630,000 people still died from AIDS-related causes worldwide, including 75,000 children. The global target is to reduce AIDS deaths to fewer than 250,000 annually by 2025, and ultimately end AIDS as a public health threat by 2030. In summary, AIDS-related deaths persist today because HIV remains a complex chronic disease that requires consistent, lifelong treatment and comprehensive health care. Barriers in access, late diagnosis, treatment adherence challenges, co-infections, and social determinants all contribute to ongoing mortality. Continued efforts to expand equitable access to testing, treatment, and supportive services are essential to further reduce AIDS-related deaths.